Okay, so I'm starting the anatomy of the pons. The pons is divided into the upper part and the lower part. The cranial nerve, which is originating from the upper part of the pons, is fifth cranial nerve, and the cranial nerve, which is originating from the lower part of the pons, is sixth, seventh, and eighth cranial nerve. Um, so this is the transverse section of the pons, and just above the pons there is fourth ventricle. We know fourth ventricle is the cavity which contain CSF, which is present in the medulla and the pons. But this is a part of lower pons, so fourth ventricle will always make fourth ventricle above the pons or outside the pons while making the diagram of lower pons. So it will be as a roof of lower pons, and these are various longitudinal fibers. These are called corticopontocerebellar fibers, and they join the middle cerebellar peduncle. Middle cerebellar peduncle connect the cerebellum to the pons. We know there are three cerebellar peduncles: superior, middle, and inferior, which connect the cerebellum to the brainstem. The nerves which are originating are 6th, 7th, and 8th cranial nerve. This is 6th cranial nerve nuclei, this is 7th cranial nerve nuclei, and this is nuclei complex of the 8th cranial nerve or vestibulocochlear nerve. The 7th cranial nerve or facial nerve always take a turn around the abducens nerve and then exit the pons. This part of the 7th cranial nerve is called as internal genu, and this turn is known as neurobiotexis. So remember this about the 7th cranial nerve. And these are leminusci. This is medial leminuscus, which is the part of dorsal column medial leminusci pathway, and this is spinal leminuscus, which is a part of spinothalamic ascending tract. And these are severe tracts. These are various tracts. This is tectospinal tract, which is coming from midbrain. This is rubrospinal tract, which is also coming from midbrain, and this is MLF or medial longitudinal fasciculus. This nuclei is the spinal nuclei of the fifth cranial nerve. This is again medial cerebellar peduncle. So between the pons and the fourth ventricular, we call it as a facial colliculus. There is this swellings present at between the fourth ventricle and this lower part of pons, and these swellings are called as facial colliculus because swellings are known as colliculus. And now we are moving towards the upper part of the pon. So upper part of the pon, again we have to make the same structure, the same longitudinal corticopontine cerebellar pathway, which are joining the middle cerebellar peduncles. But the differences will be that we can see in the nerve, because this is the upper part, only one nerve we have to remember, which is the fifth cranial nerve, will be originating from the upper part of the pons, as we read before. And the fifth cranial nerve has a sensory part, has a motor part, and has a mesencephalic part. So motor part, always remember, is present in the medial side, M for motor and M for medial. Sensory, lateral side, because motor is medial, so sensory will be lateral. And here there is one middle part which is mesencephalic. So fifth cranial nerve having three types of fibers: motor fibers, which are exiting like this, and from medial part of the pon. These are the sensory fibers, which are exiting from the lateral side, and in between mesencephalic fibers. And this is the as we know, spinal nucleus of the fifth cranial nerve. And remember, In lower part of the pons we make the fourth ventricle outside, but in upper part of the pons we have to make the fourth ventricle inside. Again, these are some tracts which are constant, same as the lower pons. These are this one is medial longitudinal fasciculi or MLF. This is tractospinal pathway. From midbrain, this is rubrospinal pathway. They have motor function. They control the flexor and extensor muscles. And now various leminusci. So in lower pons we have just medial leminusci and spinal leminusci, but here two extra leminusci, which is trigeminal thalamic tract leminusci and lateral leminusci, which is a auditory pathway leminusci, are also present here. So medial leminusci we know is a part of dorsal column medial leminusci pathway. Transverse leminusci is a trigeminal thalamic tract pathway leminusci. This is spinal leminusci, which is a part of spinothalamic tract, and this is lateral leminusci, which is part of auditory pathway. So the pathway and leminusci we have to remember. Again, I will repeat. Medial leminusci is a part of dorsal column pathway. This is transverse leminusci, which is pathway of trigeminal thalamic tract. Spinal leminusci is part of spinothalamic tract, and lateral leminusci is part of auditory pathway. There are the medial cerebellar peduncle, and now in upper pons superior cerebellar peduncle. In upper side you can also see. These are the spinal nuclei of the fifth cranial nerve, which are from pons. They are present in the all structures from pons up to the cervical 2 vertebrae, and they are important for carrying the pain and temperature from oral cavity and nasal cavity. They will be present in the all structures from pons up to the C2. So this is all about the transverse section of pons of the upper part and the lower part.